Do you know that having yellowish eyes is one of the signs of having liver cancer? In today's video, I'm going to tell you what are the common signs and symptoms of having liver cancer and how is liver cancer diagnosed and treated by doctors. Welcome to another episode of Doctor Says. Most of the symptoms are related to cirrhosis of the liver. In fact, cirrhosis is present up to 90% of patients with liver cancer in Western countries. The signs ranges from non-specific symptoms like loss of appetite, weight loss, fatigue, nausea, vomiting and abdominal pain to signs that are more specific to liver failure, and the most common would be jaundice. Jaundice occurs when there is too much bilirubin builds up in your blood. Bilirubin is a yellowish pigment, a component of red blood cell that is being broken down. When there is a problem with the liver, it can't break down this bilirubin, hence causing deposition in the skin, eyes, and urine, causing yellowish discoloration of the skin and sclera, as well as the urine, causing dark-colored or cola-colored urine. On the contrary, the stool will often be pale or appear clay-colored due to some complex mechanism that, trust me, you don't want to know. The abdomen, on the other hand, will usually be distended and filled with fluid, also known medically as ascites. During the early stages, the liver may swell, known as hepatomegaly, and one can feel it in their abdomen. As liver cirrhosis progresses, the veins in the abdomen may become more prominent, distended, and tortuous, and the medical term is known as caput medusa, as it resembles the head of the mythical Greek creature Medusa. Leave a comment down below if you see the resemblance. For guys, gynecomastia, or also known as man boobs, is seen in up to a third of patients with cirrhosis. They may also develop other features reflecting feminization, such as loss of chest or axillary hair. While for women, irregularities or even discontinuation of the menstrual cycle can occur. How is liver cancer diagnosed? Damaged liver cells can increase blood liver enzymes, and these can be easily tested via drawing blood for liver function tests. The presence of high alpha-fetoprotein, a tumor marker, is also highly suggestive of liver cancer. Imaging like ultrasound, CT scan, and MRIs can pinpoint where a tumor is developing, determine its size, and assess whether it has spread to other organs. For confirmation, a needle biopsy is essential to obtain the tissue sample for examination under the microscope. Now, moving on to the treatment, it basically comes down to 4 factors, that is, the number, size, and location of the tumors in the liver, how well the liver is functioning, is cirrhosis present, and whether the tumor has spread to other organs. Depending on the stage of the disease, treatment modalities include hepatectomy, where a portion of the liver is removed via surgery, or radiofrequency and microwave ablation, where thermal energy is used to destroy liver cancer cells. In large tumors that are unresectable or unsuitable for ablation, an approach known as TACE or transarterial chemoembolization is preferred. In this procedure, your doctor will place chemotherapy or synthetic materials into the blood vessels feeding the cancerous tumor in the liver to cut off the tumor's blood supply, thus shrinking and killing off the tumor. Last but not least, if the cancer has not spread to other organs, liver transplant is a potentially curable option. So there you have it, guys. Now that you know what are the common signs of liver cancer, do you want to know what causes liver cancer? Click on the link to find out now.